The match between Real Madrid and Barcelona was in its 73rd minute when Ronaldo noticed something happening in the stands that made him stop running toward what could have been a crucial scoring opportunity and instead signal frantically to the referee and medical staff. His actions initially confusing teammates and opponents who couldn't understand why he had abandoned an attack that could have changed the outcome of El Clasico. But when the cameras followed his gaze to the VIP section, where a middle-aged Palestinian man was slumped unconscious in his seat, while security guards argued about protocols instead of providing immediate medical assistance, everyone in the stadium began to understand that they were witnessing something more important than football. A moment when human life took precedence over athletic competition, and when one player's moral clarity transformed a sporting event into a demonstration of values that transcended the boundaries of the pitch. The fan who had collapsed was a 47-year-old doctor named Ahmad who had traveled from Gaza to Barcelona using savings accumulated over 3 years and connections that had taken months to arrange, because Palestinians faced travel restrictions that made attending international sporting events almost impossible for people whose passports were not recognized by many countries, and whose movements were controlled by authorities who viewed their presence at public gatherings as potential security concerns, rather than expressions of normal human desire to watch athletes they admired compete at the highest levels of their sport. Ahmad had been dreaming of seeing Ronaldo play in person since 2018, when he had watched from his hospital in Gaza as Ronaldo scored a hat-trick against Spain in the World Cup, and during the bombing campaigns that had destroyed much of Gaza's infrastructure over the following years. He had maintained his sanity by watching Ronaldo's matches on a battery-powered tablet during power outages, using football as an escape from the constant stress of treating patients in a medical facility that lacked basic supplies while surrounded by violence that created more casualties than could be properly treated with available resources and equipment. The medical emergency that brought Ronaldo running toward the stands was a heart attack, brought on by the excitement of finally seeing his hero in person, combined with underlying health problems that had been exacerbated by years of working in high-stress conditions, where medical professionals were expected to save lives without adequate medicine, electricity, or equipment. And while stadium security initially hesitated to respond, because they weren't sure about protocols for treating foreign nationals whose documentation might not meet standard requirements, Ronaldo's intervention made it clear that bureaucratic concerns were less important than getting immediate medical assistance to someone whose life was in immediate danger. The scene that unfolded over the following 20 minutes was unprecedented in professional football, with the match temporarily suspended while Ronaldo personally ensured that Ahmad received proper medical attention, running into the stands despite protests from team officials who worried about insurance liability and match regulations that didn't account for players leaving the field to assist spectators. And when Ronaldo saw that Ahmad was wearing a small Palestinian flag pin on his jacket, he understood that this medical emergency involved someone who had overcome enormous obstacles simply to attend a football match that most fans took for granted, but represented the fulfillment of a dream that had seemed impossible given the travel restrictions and financial constraints that prevented most Palestinians from participating in normal international activities like attending sporting events. Ahmad regained consciousness in the ambulance with Ronaldo holding his hand and speaking to him in the few Arabic phrases he had learned from Palestinian teammates. And when Ahmad's first words were an apology for disrupting the match, Ronaldo's response revealed the depth of his understanding about priorities that extended far beyond football. Telling Ahmad that some things were more important than games, and that his presence at the stadium represented a victory over the forces that tried to prevent Palestinians from participating in normal human activities, like supporting their favorite athletes and experiencing the joy that comes from watching excellence in competition, regardless of political circumstances, that attempted to define people by their nationality rather than their humanity. The delay in the match created controversy among television broadcasters and league officials who worried about scheduling complications and advertising commitments. But when footage of Ronaldo abandoning a scoring opportunity to help an unconscious Palestinian fan was broadcast around the world, the response was overwhelmingly positive from viewers who recognized that they had witnessed an example of sportsmanship that transcended competition and demonstrated values that were more important than winning or losing any individual game. Though some critics argued that players should focus on their professional responsibilities rather than getting involved in situations that could be handled by trained medical personnel and security staff. The hospital stay that followed revealed the extent of Ahmad's health problems, which included chronic conditions that had been worsened by working in a medical facility that lacked proper equipment and supplies due to blockades that prevented essential medical equipment from reaching healthcare providers in Gaza. And when Ronaldo visited Ahmad during his recovery, their conversations revealed the broader context of life in Gaza, where medical professionals worked under impossible conditions while maintaining hope that their efforts could save lives, despite systematic obstacles that made their jobs more difficult than they should have been in any society that claimed to value human life and professional medical care. Ahmad's story of working as a doctor in Gaza included accounts of performing surgery by flashlight during power outages, treating patients without proper anesthesia because medical supplies were blocked from reaching the territory, and watching colleagues leave for other countries because they couldn't provide adequate care under conditions that no medical professional should have to accept as normal, but also included examples of innovation and dedication that had allowed Gaza's healthcare system to continue functioning despite restrictions that seemed designed to make quality medical care impossible rather than simply difficult or expensive. The foundation that emerged from Ahmad's case became focused on supporting healthcare professionals working in conflict zones and areas under blockade, providing medical equipment, training opportunities, and advocacy for policies that would allow essential medical supplies to reach healthcare facilities regardless of political circumstances that had previously prevented doctors and nurses from accessing the tools they needed to save lives and provide quality care to patients who deserved the same level of medical attention available to people in more privileged circumstances. Ahmad's recovery was complicated by the stress of knowing that his colleagues in Gaza were continuing to work under impossible conditions while he received excellent care in a Spanish hospital. And when he expressed guilt about receiving medical attention that wasn't available to his patients back home, Ronaldo helped him understand that his individual recovery could become a platform for advocating for better healthcare access for all Palestinians, rather than just accepting the inequality that made his treatment possible, while others suffered from lack of resources that could easily be provided if political considerations didn't override humanitarian concerns. The scholarship program that Ronaldo established provided medical training opportunities for Palestinian healthcare professionals who wanted to develop specialized skills that could improve care in Gaza, but couldn't travel for education due to restrictions that prevented them from attending medical conferences, training programs, and educational opportunities that were available to doctors and nurses from other countries who didn't face political obstacles to professional development that should have been considered basic requirements for maintaining medical competence in rapidly evolving fields. The media coverage of Ahmad's case brought international attention to the broader issues affecting Palestinian healthcare, including shortages of basic medical supplies, restrictions on travel for medical professionals, and the impact of blockades on healthcare infrastructure that served civilian populations who had no control over political circumstances that determined whether they could access quality medical care when they needed it most. And this coverage helped generate pressure for policy changes that would prioritize humanitarian concerns over political considerations in decisions about medical supply access and travel permissions for healthcare workers. Ahmad returned to Gaza 6 months later with new medical knowledge and equipment that Ronaldo had helped him obtain, but more importantly, with connections to international medical organizations that could provide ongoing support for healthcare facilities that had previously been isolated from global medical communities due to political restrictions that treated medical cooperation as potential security threats rather than humanitarian necessities that should transcend political boundaries when human lives were at stake. The long-term relationship that developed between Ronaldo and Ahmad became a model for how individual connections could create broader changes in policies that affected entire populations. With Ahmad serving as an advocate for Palestinian healthcare needs, while Ronaldo used his platform to highlight the human impact of political decisions that prevented medical professionals from accessing resources and training that could save lives if humanitarian concerns were prioritized over political calculations that seemed designed to punish civilian populations for circumstances beyond their control. Years later, when Ahmad had become a leading advocate for Palestinian medical rights and had helped establish international partnerships that improved healthcare access despite ongoing political restrictions, when the foundation had supported dozens of Palestinian medical professionals and provided equipment to hospitals throughout Gaza, Ronaldo would reflect that stopping the match had been the most important decision he had ever made on a football pitch, because it had demonstrated that some values were more important than athletic achievement, and that individual acts of conscience could create ripple effects that improved conditions for entire communities whose suffering had previously been ignored or treated as acceptable collateral damage in political conflicts that ordinary people had no power to resolve but paid the highest price for experiencing.